Hello Sri Lantang, my name is Angela Tiona. I'm from 11H, student absent number 3, and in this video I will be presenting my discussion text titled Could a Drug Prevent Depression and PTSD? Currently, we are in the middle of an epidemic of mood disorders like depression and PTSD. We still don't know what causes it, and we still don't have the cure for any mood disorders, just drugs that suppress the symptoms. In the recent years, the field of mental health has witnessed significant advancements, challenging traditional approaches to treatment and prevention. Now, science is closer than ever to finally finding a cure to mood disorders. While the potential to reduce suffering and improve the quality of life is compelling, questions arise regarding the accessibility, over-medicalization, and the impact on personal resilience. So, can a drug potentially be the answer to preventing depression and PTSD, or will it just do more harm than good? Serendipity has played a crucial role in the discovery of many psychiatric medications, often leading to breakthroughs that were entirely unexpected. Classic examples include the accidental discovery of lithium's mood-stabilizing properties, imiprime's antidepressant effects, and the mood-elevating potential of ketamine, all of which began as treatments for other conditions or were observed as side effects during unrelated research. These chance findings have transformed mental health care, demonstrating that unexpected observation, combined with the scientific curiosity and careful study, can result in a revolutionary treatments for mood disorders. If a drug could be developed to prevent mood disorders before the symptoms even start, rather than just suppressing them after onset, the impact could be profound. Preventing the onset of depression and PTSD would mean sparing individuals from emotional suffering, functional impairment, and the risk of suicide, leading to a much better quality of life for many people. Early and preventative treatment for mood disorders is linked to better mental health outcomes, higher quality of life, and increased productivity. This proactive approach can also reduce societal costs associated with chronic mental illnesses. Preventing mood disorders can also lower the risk of related physical health problems, further enhancing overall well-being. Preventative care, including medications, can also help individuals build resilience and coping skills, making them better equipped to handle stress and life challenges, thus reducing the likelihood of developing severe mental health conditions. However, the innovation of preventative drugs for mood disorders brings significant ethical, medical, and societal challenges. Ethically, deciding who should receive such drugs is complex, especially since not everyone exposed to trauma will develop PTSD or depression. Determining risk accurately is difficult, and there's a danger of labelizing or stigmatizing individuals, particularly youth with a family history of mental illnesses. Medically, the long term of taking preventative drugs are unknown, and there's always this risk of unforeseen side effects, both physical and psychologically. Over-medicalizing normal emotional responses such as sadness or stress is also another risk, as not all distress requires medical intervention. This could lead to unnecessary treatment and potential harm, especially if normal variations in mood or reaction to life events are misclassified as illnesses. Societally, widespread preventative drug use could shift perceptions of normal emotional experiences, potentially reducing tolerance for natural human emotions and increasing reliance on medication. Altering brain chemistry preventatively could also have unintended consequences on personality, behavior, and cognitive function, which raises further ethical questions about the acceptability of such interventions. So, in conclusion, the discovery of a potential drug to prevent depression and PTSD represents a groundbreaking shift in mental health treatment. This new class of drugs could fortify resilience against stress and trauma, offering a preventative approach rather than just merely treating the symptoms. If successful, it could reduce the prevalence of this disorder, improve quality of life, and change societal perceptions of treating mental illnesses. However, this innovation raises ethical and medical questions about long term effects of medicalizations and the balance between prevention and natural coping mechanisms. Further research and testing are essential to address these concerns and realize its full potential. That's all from me. Thank you for listening.